ear camp comes from the fact that there are very few ENT specialists in this country, and those that are there and have ability to do ear surgery, they don't have the necessary equipment.
During the surgical camp, the team of doctors from Nairobi basically operate on these kids and do all this reconstructive surgery totally for free. So a few weeks before the surgeries, our clinical officers go out to the schools and screen out kids with acute ear disability. Most of the time it's perforated eardrums, foreign bodies, infected ears, and of course partially deaf kids. So they're screened and they're prepared. Preparation basically making sure that during the surgery the ears are not wet. We have to factor in the transportation of the patients from their villages all the way to the hospital. Some of these patients live really far from the main roads. So we pay for their transportation, we pay for their food, we pay for the accommodation also during the surgical camps. So we pay accommodation and food for the parents as well.
Ndio napata nafuu. Kwa hiyo ikafikia muda hata ile taka ikaa sasa stock tena wala halimuumi. Sasa ilipokuwa ndo upepo tu unapokuja na kurudi, unapokuwa mkubwa kwenda huku inanuuma. Kwa hiyo baada ya kunuuma nikaona matibabu yapo pale.
With a group of say 4 doctors, we managed to go through about 40-45 surgeries in for about 5 days. You see that they found over 250 children requiring surgery. So your idea is also to try and make sure that you make all these children get better hearing by this surgery.
We usually operate for about 3 to 4 days on these patients, and then the clinical officer follows them up. These children that have been identified early and treated have been given a chance to compete on an equal level with those children who have good hearing.
There are so many people in need. We always turn down so many people because we cannot handle the numbers. And of course, if we had the funds, we'll do a lot more.
There are lots of people who are willing to volunteer their time, because since Impact was started, most of the people that have worked with Impact have been volunteers. And what that means is that whatever funds are raised really go to the purpose that they were raised for.
It's just that compassion that you have in your heart to say you need to do something for the needy people. I think it's a question of opportunity given by the Almighty to say, do this, and you do it.
We do appeal for assistance to be able to continue these ear camps. Every time we go to an ear camp, we find somebody who has been suffering for very many years but had no access, and they are so happy to get the treatment. They're so happy to have their hearing restored. They're so happy to have their ears screened and treated.